Hey, Harpreet, welcome to the show.
Hi, Brittany. It's nice to be here. Thanks for having me.
Absolutely. Where are you calling in from today?
So I am in cloudy Portland, Oregon today. So it's slightly dreary, but beautiful as always.
Isn't that typical?
Yeah,
Yeah.
pretty much. It's not raining today, so that's nice. Usually it's a rainy weekday, typically.
Well, I am so excited to have you on the show. We're going to talk about some really, really important stuff today. And, when I heard about you and your expertise, I was like, yep, there it is. I need to have that story on the show. So I'm so glad to have you here. Let's kick off the show, though, with your background. We want to learn about you. I always like to say that we didn't usually wake up and say, I'm going to fight for women's health equality, right? We usually somehow ended up here through various ways. So give us a little bit of background, where you're from, what did you study? Where did your career really start? And how did you end up here?
Yeah, definitely. So I was raised in Arizona and ended up in Oregon for graduate school. And during that time, I was really kind of developing my sense of social justice identity, what that's going to mean, what it would look like in my career. I ended up working a lot with initially kids and families who were managing some sort of a chronic illness. And I was working as a therapist at that time. And as I was going through my graduate program, I learned that there's a lot of challenges, not just accessing the healthcare system, but just challenges in terms of how to access appropriate treatment, appropriate resources that you need just to get through the day for a family that's managing a chronic illness. So in addition to mental health challenges and community-based barriers, there's a number of different things. And so I ended up, going through my PhD program in psychology. I became a licensed psychologist. I specialized in health psychology. And I would see folks on a day-to-day basis within a hospital setting where they were sharing a lot of the same stories with me of not feeling heard by the healthcare system or feeling alone in their health journey. And I really wanted to reach out to all the folks, figure out a way to kind of bring everybody together, and digital health solutions was the way to do it. So I signed up for a job with OneDrop as their VP of behavioral science. And through this particular position, I'm supporting the development of new clinically based programs that are helpful to people living with chronic conditions. So the idea is to support adults and, of course, caregivers who are supporting adults with chronic conditions. And our job is to create lifestyle interventions. My job is to create lifestyle interventions that are going to show up at a digital space and be accessible to people. So that's what I do for work. Outside of work, I'm a wife to a wonderful partner and a mom of 3, all under the age of 4. So that's always an adventure.
Yeah, listeners, we were talking about poop before our interview started. We were potty training and all that stuff. Yeah, it's real. If you want to learn more about poop, check out our women's health, gut health. We had a great period poop episode. So we're not afraid to talk about stool on the show.
Not at all.
Women poop, women poop. We got to break that stigma.
Yeah, totally.
Yeah. We do have a YouTube channel so people can see this video recording, but for the people who are listening, can you tell us a little bit about your heritage?
Yeah. So I am South Asian. So I was born in India. I came to the United States when I was about 9 years old and have really just been on the West Coast majority of my life. So we lived in California, Arizona, and then I moved to Oregon, met my husband here, and have settled down here. So South Asian by background. And then because I grew up on the West Coast, I always have considered myself a bit of a Valley girl. Yeah. And because I don't have an accent. And so I don't really fit into the South Asian community, the recent immigrant community. So I call myself the 1.5 generation.
Yeah. Do you think that, and the reason I bring this up is because we're going to get into, as a woman of color, as you found all of these biases in AI and healthcare, digital health. We're going to get into that, but I think that your opinion is, it's really firsthand, right? Like you were like, wow, this affects me, right?
Yeah.
Do you think that when you were working in that hospital setting and patients were admitting to you, like the things that are getting suggested to me are not really, I don't feel like they're actually for me. Do you think that the patients saw you as a woman of color and thought you might have some more compassion for their experience?
Yeah. It went in both directions. So there were, because the population that I was working with, it was a little bit older, but they were all folks living with diabetes. So I would have experiences with members from communities of color where they felt heard and seen and validated for the first time because they had a provider of color sitting across from them, right? So they had a doctor who was talking to them about their emotions and experiences related to their medical condition and actually spending the time to work through and problem solve whatever the challenges were, which is different from, the 15-minute medical appointment that most folks have. A psychologist appointment is typically 45 to 50 minutes. So in that way, there was already a change. But then I would also have experiences, and this might be a different conversation for a different day, but where I was perceived as somehow promoting certain therapies because I was a woman of color. And this is a little bit more of like the racism that exists in those types of settings. So like I would potentially suggest meditation or yoga because these are tried and true impactful things for reducing stress for folks. And because I'm of a South Asian background, there would be questioning of why is she asking you to do this?
Why is she pushing Buddhism on us? And
exactly. Buddhism, Hinduism, and it was not a religious conversation in any way, but those types of ideas and challenges would come up in therapy sessions. So it went a little bit in both directions, unfortunately.
Yeah, totally. That's so interesting. Well, you are helping pioneer this movement entitled TEquity. What is TEquity?
Yeah, so it's not officially my term. There was a group of researchers, Rhea and her colleagues, who came up with the idea of TEquity. And in a nutshell, it's the strategic design, development, and implementation of design tools that are going to advance health equity. So we want to figure out a way to support traditionally marginalized communities who have experienced inequity in the healthcare system. We want to avoid replicating some of the challenges they've experienced there in the digital health space. So this means, providing more individualized care in our design of clinical design within digital tools and making sure that we're addressing some of the disparities that have impacted communities of color over the years.
Do you think that we have an opportunity to circumvent, inequalities in digital health because it's arising now versus our healthcare system, which is like a beast of a thing, which is going to be so hard and long. It's going to be a long, fight, or I don't like the word fight. It's so violent, right? But like a movement to create equality in our healthcare system. But do you think there's an opportunity for us in digital health to get it right from the get-go?
Yeah, I think, when the idea of transferring your care to a digital solution was first presented, it was kind of seen as the gold standard, that you wouldn't have to deal with, the inconvenience of having to go to a doctor's office, or you could access, very easily the resources right on your phone in your living room. And of course, the pandemic pushed everything forward at a rapid pace. I do think it was originally thought of as our golden ticket out of health inequities. But I think what's happening is that because it's still humans who are designing these digital platforms, a lot of our biases that are present in the healthcare system are now transferring over into our digital space. And I know we're going to get into that, but that I think is the challenge we want to bring awareness to and make sure that as we're designing new tools and resources, we're at the very least being mindful of how we might be furthering cultural insensitivity or cultural inhumility. We want to make sure that we're not replicating the same exact weaknesses that our healthcare system has, again, in a digital world.
Yeah. Well, it's interesting. I was talking to my friend Teresa this afternoon. I said, I got this awesome interview coming up. We're going to talk about bias and AI. And she was like, but doesn't like AI have the internet to like tap into? And I was like, listen to what you just said. The internet, like the internet is screwed, right? Like,
right.
so how are algorithms racist? Like, are they sexist? Like what, and when I mean algorithm, like we have listeners that may or may not know what I'm even referring to. So can you break that down? Like sometimes I feel like we're like, oh, well, if we take humans out of it, racism will leave too. But who made those search engines, right? It's us. The data we produce. So kind of walk us through this mindset of like, if someone's never heard about a racist robot before, like how and why does that even happen?
Yeah. So I'll give you one of like the most popular examples that exist out in the world. We all use Google, right? Google.com is our first go-to whenever we have a question in a conversation or, we're sitting in our living room and we want to.
So much so that I don't even put in Google.com. I just,
exactly.
Browser, I'm like, no.
No, you just go to the web page and you start putting information
and it shows up.
Exactly. So this was actually brought up in a study a while back, where if you were to Google images, search in Google images for, let's say, white teens, you'll see then on the results page, you'll see very sort of happy-go-lucky kids, being kids, enjoying their day at the park or enjoying their company with each other. However, if you were to put in search for Google images of Black teens, what would pop up is a series of mugshots. So right then and there, there would be a shaping in your mind of what does a Black teen do or what are they likely to do? So let's carry that over to the digital health world. In the diabetes health space, you have to know what an endocrinologist is. That is the specialist who supports your diabetes care, right? So let's say you're newly diagnosed and you need to look up endocrinologists in your area. You go to Google, right? And what you'll see typically is white male doctors. Images of white male doctors show up. If you belong to, a community of color, marginalized communities, and potentially have experienced distrust of the healthcare system or have experienced, historical trauma from the healthcare system, seeing more white male doctors show up on your Google image page may kind of send you running. So like, I don't want to deal with this. I'm not going to deal with whatever diabetes is going to bring my way. They're limited images of white female physicians, but also doctors of color present on the Google algorithm. So Google has been, kind of tapped as the first place where we experience an algorithm. And it's the one algorithm that majority of us are familiar with. But they've been working to correct some of these biases. However, we want us to continue to advance the idea that misrepresentation or lack of representation on something as simple as an Google Images results page is creating deeper problems for us. And I can say, as a psychologist, as a behavioral scientist, what we say, our thoughts, our feelings, our behavior are constantly being shaped by what we observe as normal in our environment, right? So if you're only seeing Black teens mugshots, or if you're only seeing white male doctors, you're not going to be your reality is going to be different from what reality could be, right? So it's something for us to be mindful of. And I think as a woman of color with young kids of color coming up in this digital space, it's got me concerned about, what is this altered vision of normal that we're creating for kids who are living in the digital world more so than any of us have in the past, right? So they need to be represented and to be okay with seeing themselves in some of these solutions.
Well, I bet you saw that thing that went viral was a medical illustrator that created an illustration of a Black woman pregnant with a Black baby, and it went viral. And, I know that was really impactful for Black women. Whoa, I've never seen myself in a diagram. My OB-GYN all has white vaginas, white uteri, white diagrams. But, I also think about how does that affect the physician if the only images they ever learn about, see every single day in their own workplace is all of white women. And when a Black woman comes in, like, how might that change how they treat her, right? Do you have any other examples of, so we've been talking about like racism essentially, right?
Yeah.
How about like sexism? Any differences in healthcare and algorithms and bias between men and women's healthcare?
Yeah. So I would say this particular example goes back to the slave era, where folks with Black skin were perceived to have different nerves. They were perceived to have experienced less pain than their white counterparts. And so that idea has kind of been transferred in medical training settings over the years. To this day, we know of medical trainees not treating pain at the same level for a Black woman as they would for a white woman. The idea here is that, again, some of these ideas go back so far that the Black skin is thicker, that it doesn't experience as much pain, that you don't need to provide as much treatment. So the rates at which Black women experience inappropriate interventions or lack thereof of intervention, such as in pain treatment, is appalling. You can Google this very easily, going back to Google. Some of these prevalence rates tend to be so challenging for people of color to kind of sit with and to recognize that it's 2022 and we're still dealing with issues that were presented to us back in the slave era. It's quite challenging to kind of sit with and digest often. So
how did you, as a woman of color, when you first started to like reveal these biases, how did that change your perspective?
There was a class that we took where so I told you earlier that I had worked with child and family. I had received training in child and family therapy. And at one point they were talking about health inequity issues amongst Black females. And I sat there thinking, as a potential, provider in the future, do I really want to have kids? Like if Black women are experiencing these atrocities, they're dying during childbirth because they're being mistreated or not appropriately treated. How is that going to impact other communities of color? And it really had me questioning, do I want to bring forth children in this world? And I don't even know what's going to happen personally for me in the delivery room. So I think it challenged some of the sort of basic milestones that you want to hit in life. It had me questioning how are, my friends who identified as Black, how are they experiencing some of these challenges? How are they thinking through these ideas? It really kind of shakes up your world to have your future be questioned based off of how things are going today.
What is cultural sensitivity in terms of healthcare?
Yeah, so it's a number of things. So I would say in the digital health space, what we're looking at is how are we addressing some of the health inequities that have been present for communities of color throughout the history of time. So cultural insensitivity can show up in the types of digital interventions that are created. It can show up in the specific product design features. So things like fonts and colors and other icon level development. I'm oversimplifying it a little bit, but at that level, are we paying attention to the diverse audience that's going to be utilizing this particular product for us? So, for example, when you're designing a digital clinical intervention, you want to avoid, replicating the health inequities that exist. So we know that Black Americans are more than twice as likely to die from cardiovascular disease compared to white Americans. A majority of the research that's done in developing a digital clinical program is done with white Americans. So there's a misrepresentation of that data in terms of how it's applied to folks who are most at risk for using it, right? Or need to use it. Similarly, there's a lot of like lifestyle interventions that are out there. So, we all know about Peloton and exercise interventions and tools to help you log your food, to improve your diet, or to apps that help you quit smoking. All of these tools are great. Again, there really should be designed for audiences that are they should be targeted towards audiences that are most at risk for it. So again, Black Americans are at higher risk for poor diet, smoking, physical activity. But again, the tools themselves are not always appropriately designed for the population that would be most at risk for.
Yeah, you got me thinking now, because people who are getting Peloton, they can afford a gym membership, right? And they have a car and they have a job that they can, take their hour break and go work out or whatever, right? Like the people, I get upset with Peloton because everyone's so fit already. I'm like, well, I guess I don't it's for super fit people. So I want to see more like real life humans, but whatever, we'll put a pin in that for another conversation.
Yeah.
But you got me thinking, like, who needs to be able to work out at home because their life is so full? It's not that those people that are in their huge apartments and huge homes and they have a whole spare bedroom just for their exercise equipment, right?
Yeah.
They probably have the bandwidth to go out and exercise other places, or even in their neighborhood, take a run around because it's a safe, friendly neighborhood with sidewalks, right?
Yep.
So you really got me thinking there. And then I'm thinking about the smoking thing. So I am about 14 months nicotine free. I'm very proud of myself.
Congratulations.
I got hooked on the vape and it had me by my jugular, man. That I was addicted, especially with working from home. I could vape all day. It was so bad. And I work in women's health and wellness. And I was like, this is the juxtaposition. But I did actually download several apps that like texted me encouraging things. Are those apps really targeted towards potentially, not that I'm affluent at all, but a podcaster for God's sake, but like, is it targeting people who probably could also like get an appointment or get patches or whatever versus populations of color? Tell me a little bit more about the nicotine one. That's so interesting to me.
Yeah, I would say anybody who can kind of afford a phone, have the internet to utilize the app. That's one category of people, right? Yeah. And then we have to think about who is going to be most likely to stick to some of the behavior change models that exist within those apps. So those encouraging push notifications that you get, or the messages that pop up on your phone, like who is actually going to read them and then follow through with them? When we're designing interventions, like at least from the design perspective, we have to be mindful of who is going to be most responsive. And I would say majority of the time, at least, what's existing in the literature right now, is that a lot of times people kind of go for the easy route, which is let's go with folks who are going to be easy to, who are going to easily follow our plan, who are going to show that our app works, et cetera, et cetera. And a lot of times those are people who are kind of already on the road to change. They're already
like 4 other resources outside of your app. Yeah,
exactly. So it's, again, not intentionally designed for the highest risk folks, but maybe more for folks who are going to show, oh, this is another program that you could try. And, let's amp up our percentage of completers. And
well, this is now another talking point I'm going to go around the world with, because I've often talked about that most FemTech products have been made for the affluent white woman because we lack billing codes in our healthcare system for women's health. And so what happens is that investors are pressuring their investee startups to get revenue, get traction. The company says, oh my God, Congress takes 2 years to make a new billing code. Oh shit, let's just go direct to consumer. Who's the consumer buying a $5,000 maternal belt to watch your fetal heart rate? It's affluent white woman, right? And so then all of a sudden their branding is them. And then, and then all of a sudden when you get the billing code, they're just going to specialists, right? And they totally skip the Medicaid plan, which half of the babies in the United States are paid based on Medicaid. So do you think that like startups without a Medicaid strategy are inherently kind of discriminating?
I would say it depends on what is the if the app started off in the beginning and they said this is who we are designing for, then we're not, and that's who they're marketing for, and that's what their plan is, and they're consistent with that plan, then it's not, we can't say that they're discriminating, right? But if the app claims to support all people at all levels, we know that majority of those situations are, one, not possible. I don't think the research in terms of the intervention design in and of itself is far and long enough to say we can target every single person in this population. But what we can say is we can target this unique group of people and make sure that they're receiving the resources that are available through our particular app or our intervention, right? So I think as long as your business plan is consistent with what you actually are putting out into the world, then we're kind of limiting our we're creating a program that's equitable, because you're saying from the get-go that this is the right audience and this is not the right audience. However, I think the larger point that I want to make here is that majority of the digital solutions that are out there are not even making that very clear. They're claiming that their products are available to all people when they're really targeting the affluent and a particular racial group or ethnic group and so on.
And I'm sure that when people are not successful, the company's essentially making the person feel like it's their fault. Yeah. They didn't follow through. They didn't try hard enough, but actually it was like, that wasn't made for them in the first place. And so interesting.
So I think the way that the companies could go around this is the idea of, when you're building for all people, consider the various sort of social, cultural, and linguistic differences that might be present. So if you can provide ongoing training for your designers, ongoing training in the app for whatever machine learning algorithms, models that you have within the app to increase the cultural awareness or knowledge and skill sets that are present within the app, that goes a lot further than claiming to be available to all people, but then not designing for all people.
Yeah. This is bringing me back to a very, very funny moment I haven't thought about in a long time. I used to be the founder of a dating app. It was a DNA-based dating app. And my best friend, co-founder, his name is Dr. Bin Huang. He's a Chinese immigrant, data analyst, like total genius, geeky guy. He's creating our algorithm for matching based on the DNA stuff. And so I was giving him like the biological rules. He's coding it out. And I said, okay, so this is great. We got our algorithm for the heterosexual couples. We need to also make something for the bisexual ones. And he was like, bisexual? And I was like, yeah, like the user can select both genders to want to be matched with. And there was this moment where he paused and he thought, and then he was like, oh, bisexual. Okay, yeah, we can do that. But like there was like this cultural moment where he was like, I've never really encountered this. I've never talked about it. I didn't even his brain kind of opened up a little bit. And he was like, yeah, we can make that happen. But it was like this really actual beautiful moment for me too, to open up his eyes to different sexualities and for him to be so receptive, because he's an awesome human, but for him to be he really never processed that before, was presented with this new idea and was like, wow, that's interesting. Yep. And it's like, when you're saying, how do you continue to train your UI UX designers? That's part of it, right? They don't know what they don't know. It's not like Ben is anti, LGBT. He just has never really been proposed with that before, right?
Right. Yeah, exactly. I think, again, the cultural insensitivity sometimes comes from not knowing, not being exposed to these ideas. And it's not a bad thing to not be exposed. It's a bad thing when you act or sort of create actions that kind of marginalize people as a result of not knowing. So, or not seeking that information out. So I do think it's our responsibility to both seek it out and for organizations to provide that training on a regular basis.
That's actually going to lead me to my next question, which is so Ben, great guy. Sorry, Benny, if you're listening to this, you're, love to you, dude, and using you as a case study here. He didn't know what he didn't know. Right. And so how do we know these amazing founders are out there, they're losing sleep, money, they're canceling their social life. They're dedicated to this app. They mean so good. They mean good. How do they know if they're actually being equitable and being culturally sensitive? How do we know if the end result is going the right direction?
Yeah, I think ongoing research, that is sort of the key to it all. We have to include diverse communities in the initial design of whatever it is that you're creating, but also as you're making ongoing improvements to your UI, your user experience, you have to constantly check in with the communities that you're trying to create for, right? So again, if you're making the claim that this product is available to all communities, really check in. Like, are they, if we were to throw in a few racial, ethnic, and cultural diversity pieces in there, whatever that might be, how does that impact your product feature development? How does it, what do those rates look like of completion from the users that are using your product, of change that, whatever change you're trying to create with the use of that product? You have to engage in ongoing research, and research in itself is not, I won't say that it's unbiased, but it's our best tool in making sure that we're not, it's our best tool for holding ourselves accountable for the changes that we are trying to bring about.
I know a lot of apps are using data sets that have been published or are publicly available within different databases. I'm a geneticist by training. I know we have an issue in our genetic databases where it's mostly men that's been sequenced, mostly white people that have been sequenced. There's actually now whole companies that are like essentially the Black version of 23andMe, because they're like, we literally just don't have enough Black people data. And you're literally making drugs based on white individuals and then giving it to Black people. Drugs are not working. And we're like, oops, got to go all the way back $2 billion in 10 years and try again. Because our original data set wasn't diverse. I feel for the founders. They don't have the bandwidth, the time, the money. They're not researchers, they're builders, they're tech people, right? How do we fix this issue where the baseline databases that we're using to even come up with discoveries is inherently racist and sexist? Like, how are we going to change these databases?
Yeah, I think there's a few different sort of strategies that we can utilize. I think first you have to start by laying the proper foundation. You have to allow your organization to have these types of conversations, so you have to say, okay, what are the racial, ethnic, cultural diversity pieces that we need to consider, both from a leadership standpoint, so the folks driving the strategy for whatever the product is going to be, but also in terms of the folks who are actually implementing and doing the day-to-day design that goes into the solution that you're creating. So lay the proper foundation. You could also have subject matter experts, people who are researchers, join your teams. If you have those resources available to you, those folks can be really significant in shaping what ideas are proposed and correcting any sort of errors that might be coming up before they're built into the product. I think also thinking about how do we commit to being culturally sensitive or culturally humble is probably the best term to think about here, because like we were saying earlier, sometimes you don't know what you don't know. So if you are practicing cultural humility, then you're okay with making those mistakes, right? You're okay saying, okay, we screwed up here as a company, but we're committed to fixing that, and we're going to do this by improving research efforts, or improving our leadership positions and including diverse leadership folks, or including diverse designers along the way. There's actually, this is an interesting side note, there's a 2021 survey that came out that there's a lot of young sort of technologists who have felt uncomfortable in their workplace due to like their gender or their ethnicity or their socioeconomic background or some sort of like hidden condition that they might have. And they're changing jobs to seek career growth because they cannot have these conversations at their digital organization. Wow. So the survey, I think, said it was like 68% of young technologists who are feeling uncomfortable. That's a pretty high number. So we have to think about, how do we normalize these discussions so that we're not losing talent that's going to further our product, that we're not, we're supporting people in a way that's going to not only give us the equitable solutions that we're wanting, but also supporting the diverse communities that we want to build for and build with.
Yeah, that has been my experience, is that as long as I'm presenting myself as someone learning and on the journey, that people have been really kind to correct me gently, right? I've had Black women on the show and I've said something and they're like, well, that's actually not the right term, or that's, and I'm like, okay, yep, I'll never say that again. I got it. Or, I have a transgendered friend who it was the most interesting conversation because I was actually reflecting on a memory we had pre their transition when they had different pronouns. And in my memory, I was recalling it using those pronouns, even though they have different pronouns now. But I realized I had never actually spoken to a trans person with their pre-pronouns. And it was like, how do I, and they were like, yeah, just that, please use my current pronouns, even if at that time I was I was like, okay. But like, I could tell like when I was saying the story that their face looked uncomfortable. And so I just stopped and I said, am I saying this wrong? And they said, yes. These have actually always been my pronouns. Yeah, I was presenting as that then, and okay. And then I retold the story and we were all good. But like in that moment I learned, I was like, okay, got it. We need to always, even if the story was about them, then this is the pronouns we're going to use. So just being humble. I love that. Culturally humble. I love that.
Yeah.
This has literally been such a fascinating conversation. I'm having so much fun. We have 2 last questions though that our listeners really love. So we have a lot of aspiring entrepreneurs that want to work in women's health. So what is something in women's health and wellness that you think still needs innovating?
Yeah, there's so many things though. I feel like, so I come from the background of health psychology, and then specifically I trained in endocrinology. So endocrinology is all about the sort of hormonal changes that we all experience. And I think we all know women experience a lot of hormonal changes over the course of their life, right? So I do think that tools where we are doing a better job of introducing both teenagers and young adults to what their reproductive options are. There's been some evolution in that, but I still feel like we have a long way to go in presenting those options and educating young adopters of whatever those options are going to be. Also, any type of like women's prenatal and postnatal mental health and physical health tools, I think, are still very much needed. When you're going through the experience of, trying to have a baby, having the baby, postpartum, like all of those pieces are such unique and very layered stages of your life that I do think we need tools and better education around how to support women through that. And the same thing goes with like later on life when women are going through premenopausal, postmenopausal health concerns there. So mental and physical health tools at that point. I do think that, even though a lot of digital solutions are presented for women or they're designed for women, there's still a generalized feeling of isolation or loneliness that many women feel. So like more community and like networking apps where we can kind of tap into how we are doing as women in this world, so like the apps on fertility journeys or motherhood journeys, I think would be really useful along the way.
Yeah, I'm part of this community Facebook group. It's actually part of Awkward Essentials, which is a sexual wellness CP consumer product good company. But they have this community group to like talk about their product and sexual wellness. But it's actually become this place where women say, hey, and it's so funny how they always prefaced it. Hey, I don't know if this is an appropriate comment, so feel free to like delete it. But I'm feeling so alone. And I feel like this is a safe group because you've been talking about semen for the last 6 months, you talk about all this weird, juicy, for lack of a better term, sexual wellness. Posting, I'm suffering with this, chronic yeast infection. And, or there's even men posting saying, my wife has chronic pelvic pain. We haven't had sex in months. How do I support my wife? I can't Google. I have no idea how to do this. So even the men are joining in like, she feels alone and I have no idea even what words to use, how to support. Right. And so women are so starving for that community and to feel like they're not the only one experiencing this.
Totally. And I think that like the mental health aspects of how much your hormones impact the mood that you're in, and understanding that better is a big, there's a big gap, I believe, in terms of the solutions that are available. Because I've sat in therapy with women who have felt like, I'm feeling depressed, I'm feeling anxious, or I, cannot stop eating. And it wasn't necessarily about a mental health concern. It was more that their body was going through some sort of physical change that they didn't understand or wasn't explained to them. And so, I think any type of education or better experiences that we can create around that would be useful.
Do you think, one last question on this, rabbit is so interesting. Do you think that digital health is actually the solution? Because one thing that I get worried about is as an investor and someone who's kind of sitting in the center eye of the storm here, there are so many freaking apps. Yeah. And I can't have one more app on my phone. I can't do it, y'all. I cannot have one more app that says, take a picture of this every day, track this, blow into this, and I'm like, oh, it's too much. Do you actually think digital health is the route for this, or what are the tools that we're thinking here?
Well, I don't think that one app is usually the solution, right? It cannot be, because I think we talked
about that too, right?
Multiple. Yeah, exactly. I do think having an ecosystem of apps is probably the best way to do it. So something to help you track your mental health, something to help you track your physical health, or whatever it is that you're trying to change. But building your collection of apps that you use religiously, that would be the way to go. Because in doing so, you're kind of creating your own little healthcare system, right? But it's on your phone. I do think that is the future. I don't think, one app is going to solve everything. Even though we're trying to, I don't want to sort of discourage developers from being able to create that. I do think it's challenging though, because there's so many needs that need to be met. So I think if an app is open to and flexible with how they solution for, having multiple subject matter experts kind of informing their design and potentially coming at a problem from multiple angles, that it could potentially be the one hub for everything. But at this point, I do think a lot of people, when they are successful, they end up building their own ecosystem of apps that support them.
I'm hearing a FemTech marketplace idea. That's what I'm hearing.
Yeah.
Where, you download the store and you have all these apps that are FemTech certified. They don't sell your data. They don't, they're culturally humble. They anyways, that's an idea. Our last question is, what do you think the FemTech industry as a whole needs the most right now in order to be successful?
Oh, that's a good question. I was thinking about this one. I was thinking in terms of, what have we been doing and where do we need to go next? I do think we need to do things differently than how they have been, mainly around the idea of TEquity. With TEquity in mind, we've been in the real world, whenever health equity or equity types of efforts have been pushed forth, they've typically supported women, but not all people. So not all marginalized people or communities of color. So now that we are kind of transferring some of these ideas into a digital space and we're keeping TEquity in mind, I think we need to figure out how do we make sure that the outcomes of our TEquity efforts support not just women, but all people, all communities of color, right? So the more diversity we have at the table, the more women we have at the table, both as leaders and implementers of equitable digital health designs, the more likely we are to have designs that are decolonized in some way. They're not based off of just one type of person or one type of archetype being pushed forward. We're more likely to have a collective.
I love that. Thank you so much for your time today. Thank you for all the important work that you do. This has been a fascinating conversation. I could talk to you all day.
I could as well. This is very good. I'm glad we got a chance to meet and chat.